If you know Dr. Gangarosa, you know he's an incredibly persistent man, and he's a man of vision. And around in 2000, late 2000, he started a series of meetings where he invited different groups who are working on water and sanitation to meet together and explore ways that we could be working together. So he had invited people from CDC, from Georgia Tech, the Carter Center, and CARE. And we had a series of meetings, and of course there was a lot of synergy, like there was today, among these different groups. And it was obvious that Atlanta was a nexus for groups that are working on water and sanitation, but it was also obvious that there were complementary skills. So there are some groups that are more the implementers or the facilitators of implementation, like CARE and the Carter Center. And then there are these two research universities, great research universities, Emory and Georgia Tech. And even with those two universities, there are complementary skills. So Emory, of course, has great expertise in global health and in anthropology, social sciences, the law school. Georgia Tech brings the technical expertise, also a school of architecture, earth sciences, environmental engineering. So these two schools have complementary skills. Emory tends to do more international work, so we bring our international experience, and we find that working together, these complementary skills in this consortium are very powerful. It's important that in these partnerships that the partners understand their roles, but I feel like because we do different things, we each are contributing different skills, but we have this shared goal, this shared vision of what we could do together. And it's exciting to work together. As a researcher, I want to do applied research. I love working with CARE because I see how the information that we generate can help them work more effectively, improve their programs, and they are experts at working with the governments. So something that we at a university have very little experience in. So again, it's a very powerful combination. So we have a wide range of activities, but you can say that we focus in three main areas. We do applied research. Sometimes we call that learning or data for decision making. The second area that we do is monitoring and evaluation, because it's very important in the water and sanitation sector to understand what works, what doesn't work, and why certain approaches or technologies work or don't work in different areas or different contexts. The third main activity we do is capacity building and training. And among our students, there's a tremendous interest in water and sanitation. We have students that come to our School of Public Health because of our Center for Global Safe Water. We have a huge increase in the number of our students taking courses on water and sanitation. Our students have the opportunity to do internships with different NGOs and programs working in water and sanitation, such as CARE and the Carter Center. And our training doesn't just stop with our students, it also happens in the field. So we work with partners in country, and we have field training through experiential learning. I think there's a huge demand for young people to get involved in global health and water and sanitation, and it changes lives. In Atlanta, we have learned a lot from our experiences with water. So in Atlanta, we have significant water problems of our own. We have had the water wars with Alabama and Florida, and what have we learned from that? We've had periods of drought and water scarcity where you wake up one morning and hear on the radio that there's an 80-day water supply left for the city, and you think, what are we going to do after 80 days? Pack up our cars and drive out? So having to deal with scarcity, drought, aging water distribution systems, combined sewer overflows, and equity, environmental justice issues. Here in Atlanta, we've learned a lot through our own experiences with water. And I think through those experiences, it's helped us to become better at working on global water issues and realizing the connections that there are between us.